All right, welcome everyone to this KPSRL webinar. We are joined today by our colleagues from Search for Common Ground, where we will be discussing the topic of the securitization of the COVID-19 response and specifically implications for human security in Kenya and the broader implications thereof. So I'm very happy to welcome quite a large group today. We're extremely excited to see the participation of our format here really taking shape. Okay, with no further ado, let me please introduce our colleagues from Search for Common Ground. So Search for Common Ground is a nonprofit, or some people call it the non-government organization, which is focused on the peaceful resolution of conflict. And they do this primarily through dialogue, community, and media strategies, which makes them a really innovative and interesting and prominent organization in our field. We will be hearing from Judy Kuhmo. She is the director for the Swahili Coast region. Judy came to the peacebuilding field through community stabilization programs in Kenya following the 2007 election violence. And she did that working with Professor Wangari Maathai, who was the first female Nobel Peace Prize laureate. She won that award in 2004. Judy's portfolio also includes a range of programming focused on relations between civilians and security actors, specifically in Kenya, and includes leading delicate negotiations between security forces and the local community. We'll also be hearing from Charline Burton. She's the executive director leading on engagement and strategy in Europe. Charline has 10 years of experience working previously in Central and West Africa, and that includes focusing on conflict sensitivity and humanitarian responses in programs in Eastern DRC, on the Ebola-related programming in West Africa, and also on programming on civilian and security actor relations in Nigeria. So again, we have a lot of focus and emphasis on communication between communities, civilians, and security forces, which we hope to unpack with today's discussion. Without further ado then, I would like then first to turn to Judy and ask Judy if you could perhaps give us a little bit more of a specific context about what are we talking about when we say a securitized response to the COVID-19 pandemic. What have you seen in Kenya that may be cause for concern or may be cause for increased attention to this field?
Very well, thank you, and good evening from Mombasa, Kenya. So the Kenyan context takes us back to March, when we saw the government put in place measures to enhance, to curb the spread of the virus. And what happened is that we got into very strict measures. The restrictions were very strict and enforced by security agencies that restricted any gatherings, movements. We saw curfews that were dusk to dawn. We also saw the areas that were considered as hotspots locked down, and therefore movement in and out contained, and therefore movement in and out of those places was restricted. And we also saw quite a bit of social and community kind of life also clamped down. So what happened is that when the security agencies took up the enforcement, they used very hard force. And within the very first night of the enforcement, we saw a border person in Kwale lose their life. And we also saw very many video clips coming up of violence, flogging, brutality, right through the night when the first curfew was announced. So we are aware that this is a very important thing to watch, because Kenya comes from a background where in 1998, when we had the US embassy bombing, the security agencies used hard force to crack down on communities that were perceived to be either sympathetic to Al-Shabaab or communities that were hosting the violent extremist networks. And the crackdown on those communities was very hard. And we saw in a report released in 2018, where the citizens revealed that their biggest risk to their lives was violence by the police. In our engagements also, we came to understand that communities were very cold towards any engagement with the police because of the kind of violence they had seen in their neighborhoods, loss of family members, executions. Some people were disappeared and they couldn't be traced whether they were disappeared in the hands of the police or in the hands of the Al-Shabaab or extremist networks. Right into the curfew, we began to see trends. There was increased fear and access of people seeking services. So we realized that not many people were going to seek medical help at night because they did not know how to relate to the restrictions that were put in place or how to negotiate with the security agencies. We also began to notice from the community conversations we were holding that even cases like gender-based violence, where rape was being reported, domestic violence was being reported, communities did not have the confidence to go and report it at a police station because they perceived that the police, the service has been drawn to just attend to one thing. But also, rightly so, most of the security agencies' attention had been drawn towards addressing COVID containment. And what it does is that when we have force, the evidence shown brutality, force, working in isolation and not engaging the community, is that we began to realize that there was a potential for non-compliance with the measures that were being put in place. And we're going to see rebellion. In Kilifi, actually, within the first week, we saw the administration team, the DCC, his team was stoned by the boda riders who felt that they were unfairly targeted. Going even further, we see that this kind of force has got the potential to create longer term challenges and longer term effects, even beyond the containment measures that were put in place. Al-Shabaab thrives, for example, in community grievances. And therefore, when we begin to see that the community efforts that we had put in place through our programming were being reversed because of the engagement strategy used by the security forces, that would have easily played into the hands of the networks that are trying to recruit and destabilize the nation. At one point, I remember during the Ramadan season, we had some of the religious leaders getting very angry at the measures, and they were saying that this is actually a fight against their religion. And therefore, once heavy-handed approaches, which the community has faced in the past as the government tried to address violent extremism, when they begin to see the same measures coming into place again, that becomes a very important point of concern for us.
That actually raises, I think, a really critical question here, because I think in a lot of these discussions about the securitization of COVID, you understand there's a certain amount of goodwill or perhaps good faith that the government needs to make certain restrictive movements and needs to lock down on the mobilizing of people. That's just simply good health practice. But what I think you're referring to, which is much more pernicious, is if certain members of the community, certain members of the population are feeling the effects of that differently, either because they are targeted more specifically, or because their way of life or their need for going out to collect their daily wages or to collect food are particularly impacted by the lockdown measures, and there hasn't been accommodation made for those individuals. Is there any way you can speak to maybe just that part about not necessarily the lockdown as on a whole is restricting society, but how it specifically impacts unique communities and therefore perhaps aggravates divisions within a community, within a population?
Yes, for example, in the cities where the containment was done, some of the communities, for example, in Mombasa, the people who who work in the construction in the industry, the people who are working in the service industry, the people who are providing manual jobs, including domestic help, people who travel into the islands during the day and go back into their counties, go back to Mtwapa, go back to Kilifi, go back to Kwale across the ferry. And therefore, when the measures were put in place, people who are even, for example, the supermarket attendants, all of a sudden could not get back to their places of work the next day because, the next week, because they were given 3 days to reorganize themselves. And therefore, what that has done is that it immediately curtailed livelihoods. It broke. Very many businesses collapsed as a result of that. And even the border riders who are moving people up and down, for them to comply very quickly, put in the hand washing, put in the masks, and also ensure social distancing as they were carrying their passengers. That was found to be very hard to shift very quickly, but also with the fact that people are still trying to look for means and ways to feed their families off their daily wages, which is what they got before the containment measures. So there was anger, there was frustration, and therefore when the sudden use of force came into place, people were lost. The very first day when people were trying to cross and use the ferry, we have a place in Kenya that just has the ferry as an option for people to move from the island into the mainland. And it gets very congested during the peak hours. And the measures that were put in place had not put in place crowd control or de-escalation. And the first evening, there was quite a lot of tear gas and flogging that happened, trying to manage people accessing the ferry. And that caused quite a lot of anger right from the very first day when the containment was done. And therefore people now are having to deal with issues around basic needs. How do you access basic services, or even how do you get help?
Yeah. No, and I think it's really important to kind of understand that to a certain extent, this understanding of the public health needs is to be expected, but the way that it's been communicated has created some very severe problems that are potentially more long-lasting. I want to take the opportunity then to introduce Charline into the conversation, because Charline, what Judy's touching upon, I think, obviously is very specific to what she's seen in Kenya, but might actually have been picked up with larger global trends that you've been witnessing. So I wanted to ask how does this picture fit within the global understanding of the pandemic and the response there too?
Thank you, Megan, and thanks everyone for being present today. Yeah, exactly. I mean, it really fits into a wider trend. We're seeing it in many of the countries where we're operating. We're in 30 different countries. And what we're seeing now is that, this pandemic is showing how easily the response can make good relations stronger. We've seen, in different countries, people bonding together with the security forces to ensure that lockdown measures were going to be respected. But at the same time, we're seeing also how easy it is to make weak relations worse. So in Kenya, we have this pre-existing condition that Judy talked to in terms of the role of security forces and their relations with the civilian. And when you put the army front and center in your response to COVID without considering that pre-existing relationship and that pre-existing situation, then you can see the relations worsen. You can see that it will sometimes degenerate into violence and create some schisms that are really difficult to repair. So it also has, long-term consequences in the future. We've seen this in Kenya, 12 people deceased in the first 2 weeks of the lockdown. We've seen this in Nigeria, 18 people who passed away due to the police and security forces in the first 3 weeks of the lockdown. We've even seen this in Belgium, where I'm currently located, with increased checks on some communities that feel they're already marginalized and targeted because of their belonging to certain identity issues in the suburbs of Brussels. So it's not the exclusivity of the Horn of Africa, but what we're seeing is that these preconditions then do not help ensure that the lockdown measures are going to be respected in a way that's that meets the needs of the different elements of the community. So those who already feel discriminated against are going to feel even further discriminated against. And that's why we've been trying, and other organizations like ours have been trying to frame this COVID response not just as a health crisis or as an economic crisis, but also as a peace and security issue as well. And we've also seen that, it's not just this pandemic, it's also, for instance, the Ebola response that we've seen in the past, or when it comes about, different types of conflict. We've worked with, for instance, just last year, 13,000 military and police officers across the globe in the work that we do on security sector reform. And it really shows that it's so important to build whole of society security forces where everyone feels they can be represented, that the policeman, the military officers that's in front of you is actually someone whom you can feel is part of your community. I'd like to point out two elements that really we're seeing in the Horn, but that's also more global, is on the makeup of the security forces and on the training of the security forces. So when you think about the makeup of the security forces, you want to be sure that your force is going to be representative of the different component of this population. So Judy was saying some people or religious leaders thought that maybe the measures are meant to be against the Muslim because it's Ramadan and you don't want us to be gathering and celebrating for Ramadan. And there's this history of countering violent extremism and Muslim communities feeling that they're targeted. So if you do not take this into consideration, if your military and police force is not equally representative of the different component of the society, it's going to be difficult to be perceived as neutral. And the second thing is, well, before I move to the second thing, I would say also, there are also other obvious things, just like gender, for instance. How can your security forces take into consideration the specific needs of women versus men in such a crisis? If you do not have female in your force, then it's going to be difficult to think about issues that are specific to women and girls. The other second element is on the training. Oftentimes, and we've seen this actually as a global trend beyond the COVID, is that the security forces oftentimes feel like they have just one tool and they've been trained to use that tool, which is force. So they use intimidation, retaliation, threats of punishment, as opposed to de-escalation tactics, communication, and collaboration. And sometimes it's because they haven't been trained on this. So that's why we feel it's important to also address these two issues. And with COVID, you can say that the situation is ripe for these kinds of problems, but it's certainly not inevitable. It's really important to take this into consideration, most importantly in a time where everyone's super stressed, they've lost their job, it's difficult to go to the market and purchase food. Then you'll easily end up with a very adversarial, violent, and sometimes deeply violent, sometimes deadly interactions. So it's natural that government take up such measures and use security forces to ensure the measures are followed through. But those are the kind of considerations that need to be taken into consideration if we want to ensure that the responses are followed by the communities and accepted properly by everyone.
Absolutely. No, thanks for that elaboration on kind of the global trends. And it's I think really important, and I've been hearing myself say this more and more often, that I think we're often perhaps the community of the knowledge platform used to speaking about these issues in terms of partner countries of the Ministry of Foreign Affairs or countries receiving development aid. But so much of what you said, we are seeing play out in the developed world as well. The way in which the police are used perhaps in a more expansive role in society than they should be. And how does training feed into that? And what are the instruments that the police feel that they have at their disposal? I want to maybe ask, and I am aware that I think in a few minutes we'd like to open up the discussion to others in the room, but I wanted to touch upon something I thought was really important, and I'd like to hear a little bit more about, Charline, about this whole of society approach. And can you elaborate a little bit about what does that mean within Search for Common Ground, and how do you see that as being a better way forward in terms of engaging security actors? Yeah,
so what we've seen is that if you do not involve the communities themselves and the different elements that the society is composed of, if you do not involve them in the decision-making process around the measures, you'll likely be missing on some of the important points that will make the measures be accepted or not accepted. That will be the difference between communities collaborating or actually rejecting you when you want to ensure order or ensure that measures are enforced. So the approach that we've been taking is to create these mechanisms where security forces can actually first be trained on these de-escalation techniques, on collaboration techniques, on why it's in the first place important to liaise with communities and how to do so, and then ensuring that there are forums in place, that there are spaces where communities can provide feedback, where they can share their input, where they can say, okay, we're fine with doing X, Y, and Z, but we think it would be best if you would communicate this way, if you would maybe change this time and move it to another time, because it's much more acceptable to our women, it's much more acceptable with regard to our culture. So that's what it means. It's ensuring that the different components are represented and able to communicate with the security forces. And then at the more global level, it's also, at the more national level, I would say, it's also supporting the government in diversifying their security forces. It's how to make it more appealing to women, how to make it more appealing to communities who are actually not trusting the security forces, so do not really feel like they want to engage into the security forces.
Thanks. No, that does actually make it clear a little bit more what do we mean by that term. And it actually gives me a good bridge to come back to Judy. And Judy, are there ways in which your organization has been working specifically in Kenya that has been speaking to exactly what Charlene's talking about? How do you create those spaces for engagement, especially now when there's restriction on people gathering, when there is all the more mistrust between communities and police? How do you create such an environment in these fraught times? Judy, your microphone is muted.
Right. I could give two examples of ways in which we have been able to work around what we began noticing. One, in Kwale, when we saw quite a bit of anger against the security agencies and human rights community decrying the fact that police reforms that had been addressed, that were addressing human rights, were beginning to get backtracked. We putting together resources from the projects that we have, and we began to host dialogues. As a peace building agency, we work with people on both sides of the conflict, and therefore we identified those communities where the community where the first young man passed away, the first motorbike rider passed away. And we also approached the security agencies, the police in that community. And we've had several rounds of discussions in the hangouts where the young people are found congregating as they wait for their passengers. We've also had conversations inside the communities, both held by the motorbike riders and the security agencies, as a way of, first of all, building the relationship again and beginning to talk about what really happened on that day, but also what the community of motorbike riders, and there are about 1,500 of them, what the community of motor riders could do and work together with the security agencies to protect their communities from the surge of COVID that was already being witnessed in Kwale. The second example is in Garissa, where we have quite a bit of poor infrastructure and very limited communication infrastructure. For example, radios, women are not able to access radios. The networks are also very poor, and therefore working online became a bit of a challenge. We had women who then teamed up with the security forces and went into the communities and held conversations around security. In those communities, we had seen an ambulance in the very first days, had stepped on an ID that had been put on the road by the violent extremist networks. We then went into those communities and have been having the women and the key influencers working alongside a public health official, a public community worker, alongside the chief, to have those conversations in the community about COVID management, COVID response, but also looking at the wider security risk being right across the border from Somalia, what that means in terms of making the community more safer and resilient to recruitment, but also resilient to COVID.
Thanks. Your elaboration really kind of helps clarify a couple key ingredients or maybe vectors through which to channel kind of focus. And it seems to be that, you know, regaining trust or trying to create opportunities to build trust or at least conversation between groups. But also I think what you touched upon, which is incredibly important, communicating what new regulations might be, what new lockdown measures might be, how to effectively communicate that within the different communities that are represented within a population. A couple of weeks ago, we had a really interesting webinar specifically on misinformation, information corridors, how to communicate effectively, because if nothing else, information itself can become a divisive issue if people aren't receiving the information in a similar way, or at least in an effective way. So how do you channel information through the different communities is a really important thing to be touching upon. I want at this point to just draw attention to those of you who are in the participants list. I'm going to turn to you next. So if you have questions that you would like to address to Charline or Judy, you can either enter those in the chat, you can do that publicly, or you can submit your questions specifically to Knowledge Platform, Security and Rule of Law, that's at the top of the participants list. Or you can raise your hand. So I'm now allowing those of you who wish to contribute to the conversation to prepare your question, prepare to raise your hand, and maybe think about how you'd like to engage in this discussion, because again, you're participants, you're not an audience. With that, I'm going to turn my final question actually back to Charline. So what we've heard from Judy and kind of what you're seeing within global trends, what is it exactly that international actors can do that can support effective responses in this time?
Thank you, Megan. I would say there are three things that we could do, probably more, but I'll point at three. First is preparing for disaster, because, you know, trust is not something you can build the day that disaster happens. And I hope it doesn't happen, but probably this pandemic is not the last one that we're seeing, and there may be other kind of disasters happening. So it's important that we build this trust. So, you know, we're talking about who is part of the security forces is not something that you do overnight. Creating networks is not something you do overnight. And one of the reasons why we were successful in Kenya and more globally is because we had this, you know, years of building relationship and trust with different community and security forces. And so we could just activate. The WhatsApp group was already there. You know, we already had the list of contact of people we knew, and it was really easy to activate this. So prepare for this. The second element I would say is to be sure that in the COVID response that some of us in this group are elaborating or supporting, if you're from government, is be sure that this response integrates whole of society approach, participatory methods, and that it's conflict sensitive, that it thinks about how this response is going to be affecting people differently, how they're going to be perceiving this response differently based on their identity group. So that's the second element. And then the third element I'd say is that we also foster learning. So there are a lot of really great organizations, great actors, either local, regional, international, who are doing great work. And they're documenting the lessons on what works and what doesn't work. But sometimes they just keep it for themselves. And sometimes they're not doing so great work, but there are also great lessons to learn from it. And so it's important to actually create that space, just like the it's a hard acronym, right? The Knowledge Platform. It's also important to have this kind of forum and support this learning and evidence sharing. So yeah, that's what I would say.
I think those are excellent lessons. And yeah, I think one of the lessons the KPSRL can learn is to find a more usable name. But yeah, thanks. I think specifically you're pointing towards the way in which even when programs aren't working the way they should or the way expected, like there are important lessons to be shared there. So how do we exchange those lessons more fluidly and more actively to make sure that a broader group is benefiting from that? to that point on exchange and learning, I'm not seeing any hands raised yet, and I don't know if Melissa might have received a question directly. Melissa, do you care to weigh in? Otherwise, I'll carry on the conversation with Charline and Judy.
Sure, we did receive one anonymous question, which is not specific to Judy or Charline, so either of you feel free to chirp in. The question is, what can be preventative measures to curb violence by security forces in the future?
So I don't know if Charline or Judy feel specifically inclined to take that one. I think it's a really important question, not only because it can be useful, but it also helps, again, reshape how we understand security forces and the role that they might play. I think, as Charline pointed out earlier in the discussion, they seem to have one tool in their toolkit often, and that's coercion or force. So is there a way that their role could be played so that de-escalation or prevention might be more quickly resorted to?
Okay, I want to build on the three that Charline spoke about, which also speak to that. Of course, when the police service is getting trained, one of the key things I think that come out is the use of force. So another component would be the use of non-violence, de-escalation, crowd management, and for me, at community level, what is missing is that interaction. The conversations that the security team sits to plan on how to manage the communities need to have community representation as high up as possible, whether it's at national level, that we have various voices sitting in those spaces where the decisions are being made. That way, for example, when you come down to the county, to the Mombasa, and you're talking about how to contain the crowd at the ferry, and you've got very many actors, that information will already have been shared in wider platforms rather than through the media. Because what happened in the first place, the information was coming top down, media, through the media, and it was like being talked to rather than a conversation. So I think the very first instance is that there needs to be that opportunity for inclusion and engagement when developing security strategies. And we've seen that work in some of our interventions. We've worked with the government to lift a night fishing ban that was in place for 6 years because of the threat of Al-Shabaab crossing over. And what really worked was bringing together different people, women, men, youth, fishermen, religious actors, all to look at it differently and provide various ways of addressing it. So having a whole society approach and having a multi-stakeholder approach helps manage this kind of sudden. So it requires a strategy to make sure that inclusion has happened.
I think that's a really interesting point, especially in contexts where I think it can be taken for granted that, oh, we work in a democratic society and we have democratic representation through our political channels, but that's not always quite robust enough to reach into and affect and work through service delivery, such as the public health sector, but also the security sector and also education sector. So how to make those institutions, those arms of public services also more democratic in our approach to kind of democratization and increasing people's participation in their government's outreach. I'd like to take maybe a risky chance and see if those who are comfortable wish to go ahead and activate your camera at this time. I think that might help create an atmosphere where it feels like there's more than just the three of us in the room, because there are. There's quite a number of us in the room. We're very excited to have so many people actively engaged. So if you feel comfortable turning on your camera and joining us here in the screen, you'd be more than welcome to help create the conversation. Also, for those of you who joined late, we would really welcome it if your name featured not only you as a person, but also what organization you might be working with, or if you're independent. That helps give everyone a bit more of a view of who's in the room and what counterparts might be listening to your ideas or your points of view. I'd like to then go ahead and call upon Patrick Milabio. I'm sorry if I've mispronounced your name, Patrick, but please feel free at this point. I see that you've indicated you'd like to ask a question. So go ahead and ask. Patrick, we're not hearing you. You might need to unmute yourself. You can find that option at the bottom of your screen on your left. Unfortunately, I don't think we're hearing your question still, Patrick. You did write it in the chat, so I'm going to go ahead and ask it out loud. So Patrick is from the Social Science Center for African Development based in DRC. He wants to know whether or not...
I think his mic is
Patrick,
working.
yes, there you are.
Can you hear me now? I think I'm there. Yeah. Thank you. Can you hear me now, I think?
Yes.
Perfect. My name is Patrick. I'm from the Social Science Center for African Development, actually here in Democratic Republic of Congo. I have two questions. Number one, I want to know whether Centre Locolea, we call it here, is Search for Common Ground, whether they used or worked with community health workers to try to build up trust between community members and the frontline, the reports frontline of COVID-19 in Kenya. And or what do they think about community health workers? Can they contribute to build such trust? Number two, do you have experience with the use of WhatsApp audio or messages? Because here in Congo, many people are spreading out fake news through WhatsApp messages. Do you have any experience with this, or do you think it can work? Thank you very much.
Excellent questions. Thank you very much, Patrick.
Maybe I'll try and answer. Patrick, thanks for your question. And so everyone knows we have sometimes local name in some of the countries, so we're Centre Locolais in the DRC indeed. So I can't speak specifically about our response to with the health community mobilizers, but that's in principle the kind of people, I mean, I can't speak about them specifically in the DRC, but I know that's exactly the kind of people that we want to work with, whom we feel are closer, great middle ground, if I can say so, between the communities and those who are meant to implement orders from their hierarchy. So what we're recommending is indeed that if you want some measures like these ones that are so drastic to be taken into consideration and followed through, that you need to work with such kind of people who represent the community, who know them sometimes by name, and work hand in hand with them. And that's really globally the approach that we're trying to take in ensuring that, wherever security forces have to work, that they liaise also with local chiefs, with local health workers, with people of influence. And we go also beyond the health sector. We also work with influencers, sometimes YouTuber, or people who do, who share a lot of WhatsApp messages and who are influential in their communities. We work with them. And to answer your question on the WhatsApp group, yeah, absolutely, we do work with WhatsApp group. We try and actually find whatever it is that people listen to. So if WhatsApp is the tool and the medium that people listen to, we'll use WhatsApp. If the community radio is the one that they're listening to, Radio Amani or I don't know which radio, that's what we're going to be using, so that we can be sure that people who need to hear the message can hear it, and not just hear it in French or English, but or in Swahili, but that it's also in their own very local languages. So it's someone from that ethnic, religious background that's going to be speaking in the local language, so that people trust the message and understand it.
Thanks. I think that's an excellent answer. Judy, did you have any things that you wish to elaborate on Charlene's answer on that point, on those points?
Just to say that we have worked with health workers in Garissa, and they are very key personalities in the community because they have long-standing relationship on various issues, and therefore when we went in to engage with the security matters and then added the community health worker, addressing very sensitive security challenges became a very easy conversation in communities where, for example, speaking about recruitment and radicalization was hard. When we go in the health worker, it becomes an opportunity to have a bigger discussion around community security, focusing on health, focusing on safety in various ways. So it's an important way of identifying them as important influencers in the community.
I think it's an excellent point, and also a way in which you can respond very specifically to the moment as it is, using the trust that health workers have and the reliance and the faith that people have in health workers as an important entry point to brokering conversation. I also now want to acknowledge Charline Abang from the Dutch Embassy in Kenya. She's raised her hand and would like to ask a question. So Charline, please welcome you to the floor.
Oh, thank you very much. And this has been really exciting. I just want to make a comment, not really a question. And I was happy to hear about, speaking about having tailor-made security solutions that we ought to have had, because you saw that when we went into lockdown, we really were basically copying what had been happening in some areas without taking into account the local context, culture, gender, religion. So for instance, with Ramadan coming up, and at the coast, it's largely Muslim, that was not taken into context. That with Ramadan, the family context is very important, and people sit together to open the fast. So when people were stopped from even doing these family gatherings and connections, it really was not taken in a positive manner. So the copying, I think, was really not done in a very good way. And also the context at the coast, where people for a long time, especially young people, in Kenya, we say that to be young or to be poor, it is criminalized. And so you find that the young people and the poorer people are the ones who borne the highest brunt of these security measures. Because we needed to move a lot more. They're the ones who could not do some of this social distancing, or how do you work at home when you, as my colleague from Mombasa said, when your work is to ride the motorbike. So how do you ride the motorbike from home? You need to get out. But these are things that were really not looked into. So I think also in future, really do a proper assessment on your conditions specific to the country or specific to the region where the measures are being put in place, so that they're responsive and not really continuing to have a bigger divide between the communities and the police. Yeah, so also the aspect of criminalizing poverty has really contributed a lot to the negativity of the measures that have been enforced. And thank you so much for the presentations.
I think that raises a really important point, and a theme that we're kind of working through in many of these questions and dialogues is specifically about creating those opportunities for discussion prior to a crisis, so that such, let's say, relationships or ability to communicate with specific communities, that the groundwork has already been put in place, the infrastructure for that communication and that conversation is already in place, so that you're not trying to create new relationships in a moment of crisis when people are feeling stressed and under pressure. So I think it's a really excellent point, specifically that Charline raises, about how the moment is preceded by all of the actions and the relationship that has been created in the past, and now we see the implications of that in this current moment. To avoid maybe getting on too dark of an end, I want to ask maybe either Charline or Judy, if you have specific things that you've seen in the moment that are reasons for hope, or good practices that can be built upon, lessons that other people in the conversation can maybe feel like they've also seen as well, or something to replicate in other areas if it's applicable.
Judy, I think you can go.
All right. Am I audible? Hold on. All right, yeah, I am. As we get into this moment where we reflect on things that build hope and courage, one of the things we also realized in in the security sector response is that once the community was asked to stay at home, and people were not given clear directions on how to access essential services or even how to look for help when they were in trouble. It meant that people who are in trouble couldn't leave their homes. And one of the things that we are realizing is that we are noticing high incidences and reports of gender-based violence that has happened over that time. We also know that the security agencies are the entry point into the justice system. And therefore, when they became inaccessible, the communities felt that justice was no longer being dispensed. And therefore, them who would have wanted to perpetrate crime or criminal activities then knew that there was the focus and attention was drawn to other things. Them that wanted to report incidences to the police station had been asked to stay at home and therefore could not find ways of reporting those incidences. So what we have also done is that we understood that connection very early on, that the security actors also have got very many other actions that they anchor. And we have had conversations where we've now brought the security anchors and the criminal justice actors, say the probations, the magistrates, to have a conversation on air on how young people, girls, women can still come back to the police stations and record their cases or have justice done. People who are still waiting for bail for their crimes, that they have been accused of. We went to air with the security actors, and they were given options, and some of them were released as a result of that. So we are trying to bring together all opportunities that enhance the work that the security actors are doing, making it more community responsive, but also putting the voice of the community. One final one is that we worked with one unique group of people, persons with disability. And we learned from the engagement that we did with them is that the COVID interventions never considered them. One, the stay at home or the limiting of social distance, for them that require to be moved around, who don't have proper aids, would need to be carried, would need to be supported by teams. They would still require, some of them still needed to go out and look for food, to beg, and all of a sudden they were put into trouble. And those ones who were taken to quarantine centers by the security agencies were taken to centers that were not friendly. So they could not access the beds, the toilets were not accessible. So there's all that that needs also, that we have been able to work on, and we got a reprieve. We went to the security, head of security, and he gave some waivers for persons with disability on the same. So there is the interest, and we can see the government has begun opening up opportunities for collaboration and listening. So this kind of information, whatever knowledge we build, would also be important to share so that them who are designing the strategies can also learn and adopt the practices we are. We're also thankful that the communities are providing resources that are helping us move these programs ahead.
Thank you. So kind of maybe not in the beginning necessarily a positive or hopeful message, given that it unveiled quite a lot of new levels of challenge in terms of the way that the security response affects unique communities, but ultimately positive in terms of opening up conversations with the government about those communities and the unique needs that they have. We have time, I'm looking at the clock, for 2 more questions. We have 2 people who have raised their hand, George and Felipe. So we will address their questions next. If you have a question that we did not have time for, I suggest that you either write it in the chat, or at the end of this session, we will be sharing the contact details of Charline and Judy so that you can maybe submit your question to them directly. So I will have a closing remark at the end of these questions, but I now turn to George Grayson from International Alert. I welcome you to unmute yourself and go ahead and ask your question.
Thank you very much. Thank you very much for the presentations. It's really informative. I mean, looking at this moment in the context, or the sort of longer term context of police reforms in Kenya, which have been sort of ongoing, I mean, particularly since the post-election violence. I mean, how do you see this this COVID-19 response affecting the sort of trajectory of those reforms? And it's highlighted again the issues of sort of police or the problems with the police and the approaches in Kenya, but equally the government has still used a sort of securitized approach as a key part of its response. So how do you see this sort of moving forward having an impact on, you know, either positive or negative on police reforms? Thank you.
Great question.
I could go ahead and answer. So the reforms, we've witnessed that anytime there's a sudden need for security agencies to come into the community and work with them or manage or address a certain grievance, the use of force ends up becoming their default way of doing things. When we had the last elections, not too long ago, we noticed that there was force, use of live bullets, targeting people who are found to be protesting in the streets. There were killings, children were shot in the balconies. And the police force came and said that those were rogue officers, the bad apples. But I think going forward, the issue of bad apples really needs to be addressed in a more concerted way, such that if it requires retraining on crowd management, de-escalation, and engaging communities in a non-adversarial way, because I think they also, the instructions that they have is that go and deal with that issue. And the person who sends that command really does not tell the person who is being sent to the field how to deal with that issue. So how information is also relayed down the ranks is very important, so that the foot soldiers who interact with the community are more aware of human rights approaches, conflict sensitivity, working with community, things like that. You'll find that the top layer of the security force is aware, they attend workshops, they're trained, but the foot soldiers is where really the problem is, how they handle frontline. So lots more focus needs to be put on the local, how the local level frontliners are engaging with the community. And then put in feedback mechanisms. Just recently, the IG, the Inspector General, asked public to send him videos of police who are misbehaving. But then the question was, what have you done with the other videos that we've shared about police brutality during COVID? So there's that conversation and a feedback mechanism that needs to be put in place right across.
Excellent. And also perhaps maybe picking up on current momentum globally around the focus on the need to question the shape that the police have taken in societies across the world and around the world. But an excellent question. For our last question, I'd like to turn to Felipe Estre from Restal. So Felipe, and I'd also like to point out that there have been a couple questions submitted to the group in totality who are in the chat now. But with that, Felipe, I welcome you to the floor.
Okay, thank you very much. Can you hear me? Okay. My question goes on the same line of the last question by George. I was thinking about exactly the impact of security sector reform on dealing with the situation. And in Latin America, we see that in many countries, the response of the armed forces was essential during the first weeks to deal with the situation. But I completely agree that it is a slippery slope, in the sense that once they begin acting like that, it's quite easy, especially in some places, in some difficult countries, that the situation will turn bad, or the armed forces will take or will try to take a kind of higher role or a more prominent role inside the countries. At the same time, how can you deal with the necessity that sometimes you have because of the logistic capabilities of the armed forces, or the fact that they have available personnel and they are important during this crisis? How can we, not specifically talking about the police forces, but how can we and think about armed forces and global and democratic governance during this time of crisis when we have to deliver a response in such a short time frame?
Maybe I can try and give an answer, and it's not the right answer, but it's just some elements to think through. From the peace building perspective, so, you know, we're not a human rights organization, but from the peace building perspective, what we would say is that trust is a very long, I mean, it takes a lot of time to build trust, and it's really easy to break the trust. So in terms of the impact of how the crisis is being managed today, it can have really long-lasting effects on what the reform of security sector is going to look like in the Horn, and more globally speaking, how things are moving forward. So we can see, you know, that some of the gains that have been made could be lost because of the crisis being improperly managed, and because of it triggering a lot of suspicion, a lot of rejection by some communities. At the same time, we're also seeing that the government, because it has to deliver, because it has to ensure the measures are in place, will sometimes use more force, and there will be, for instance, not just physical force, but also closing of civic space on the grounds that it's, you know, we do not need confusing messages. We want to control the information that's being sent out. So that's also an important element of what can happen. And that's really something that needs to be taken into consideration in terms of strengthening the capacity of civil society organizations, human rights groups, defenders who are out there and trying to do their job to support them in continuing doing this. There was a comment talking about hotline to report violence. That's also the kind of system that can be put in place to increase the trust of the communities in the government. So I'll stop there, but there are many other elements, obviously, to this that you can take from different angles.
Yeah, and I think maybe important venues to follow up on. I think the link between civil society space and security sector reform are kind of two topics that are often run in parallel and do really deserve a lot more kind of integration. And what does it mean to increase or reduce civil society space, and how does that impact SSR programming or SSR ambitions? So excellent avenue. And I know that I believe within Arrestal, I believe Ibo Hutchful has been working on this topic, as has Oxfam Novib as well. So I would encourage some more community discussion around this point specifically. But I think excellent points. I am aware now that we are running over our allotted time. I want to thank very much everyone who's been available to participate in the discussion. And again, thanks very, very much Charline and Judy. Just to let everyone know, we can share their specific contact details at the end of this meeting. So if you do want to continue the conversation with them specifically, feel free to give them an email. Otherwise, you're always welcome to contact us at the Knowledge Platform. You can do that via our website or at info@kpsrl.org. And then you'll be welcome. We are all, just to also give you a heads up, you'll be receiving a survey about this specific meeting. We want to know from you, how did it work? You know, what did we feel about the atmosphere in terms of the interactiveness? So please do go ahead and share your thoughts, give us your feedback. We are always looking to improve. And so we definitely take that feedback seriously. With that, and I'm at the moment kind of seeing only a few of you now, but I want to thank everyone for your participation and be respectful of your time. Judy or Charline, do you have any closing words you'd like to leave us with?
Judy, go ahead.
Right, so to say that we all are like the hummingbird that Professor Wangari Maathai spoke about, that all our efforts count in whatever we are doing. And especially coming into a space where all of us are learning very quickly, it would be of all of our interests to keep these kind of conversations going, but also to adapt some of this knowledge that is coming through these platforms to see our communities and governments able to better respond to security crises and challenges that come up as we move ahead. And best wishes, Baki Salama. Stay safe.
Thank you. Thank you everyone for participating. It was great being part of this, this meeting. Not webinar meeting, right, Megan?
With participants. Thank you everyone for joining us, and we look forward to seeing you again in our next online engagement. So thanks again, everyone. Bye.
Thank you. Thank you for you too. Goodbye.
Bye.
Thank you.